Caroline, thank you for that. Harris County Judge Lena Hidalgo helping to distribute COVID vaccines to kids in our area. Harris County Public Health Department will begin administering the vaccines tomorrow. The FDA authorized the vaccines for children between the ages of 6 months up to 5 years.
Both vaccines, Pfizer and Moderna, for these particular ages were studied in thousands of children, and there have been no reported cases of serious illness. Children, of course, do not face the same risk of COVID as adults, but that doesn't mean that there isn't a risk and that we shouldn't keep them safe.
The authorization comes as the Houston area experiences a spike in new COVID cases. And cases of COVID-19 continue to rise here in Houston and surrounding areas. And the city's health department is calling the current level high. Joining us to talk more about this is Dr. Thomas Giordano, professor and section chief of infectious diseases at Baylor College of Medicine. Dr. Giordano, we appreciate you taking some time. So we do know that the positivity rate is going up week by week. At this point for you and other doctors, how concerning is this?
Well, it's concerning that there's a lot of COVID in the community right now. The levels, if you look at the wastewater program that Houston's had in place for essentially the whole pandemic, are 5 to 6 times higher now than they were during our July 2020 bad summer wave. And they're approaching where we were in the holiday wave that we had in December 2021 and January 2022, when so many people had the Omicron variant of COVID. So there's a lot of COVID in the community. You're not seeing it in all the numbers, the official numbers, because there's not as many people getting the PCR tests. They're doing the self-tests at home, which aren't getting reported. But there's a lot of COVID out there right now. So we're concerned, absolutely.
And one of the barometers or the metrics that you all look at always is hospitalization. So where does that stand right now?
Hospitalizations are fortunately not that high. If you compare to where we were in July 2020 or even the Omicron surge, they're much lower still. And that's great, even with all this COVID in the community. So hospitalizations are going up. There's no doubt. We were at very low numbers a few months ago, and they've gone up 2 or 3-fold actually, but they're still 15-20% of where they were in the holiday surge of just a few months ago. So hospitalizations are going up, but not dramatically so. And I think that's attributable to a few factors. First, a lot of people are immunized, and if you're not immunized, you should be. And now we can immunize the youngest children in the population, so that's great. People should get a booster if they're eligible. The other thing is there's a lot of natural immunity out there that's not the same as having vaccine immunity, but that does contribute to the reductions in hospitalizations. And then last, there's medicines to treat COVID right now and prevent it. So if you do get COVID, I would certainly reach out to your physician to get prescribed the medications to treat it if you're at high risk for getting severe illness.
We've got about 20 seconds, and I do want you to talk a little bit about the vaccines for kids 6 months up to 5 years. You did mention that. I know there are a lot of parents who may be hesitant still to let their kids get the vaccines. What advice or what would you say to them?
There are some people who are never going to get vaccines for their kids. It's hard to convince them. But if you're on the fence, I think the science shows that these are safe vaccines. They've been given to thousands of kids in this particular age group already, tens of thousands of kids in this particular age group already. And I would just go for it. You don't want your kid to bring COVID into the house. Even though you might not end up being hospitalized, you could get long COVID, you could be out of commission for days with fever and sick, and now's a great time to get vaccinated, especially for the kids.
Dr. Thomas Giordano, we appreciate you. Thank you.
Very welcome.